But how can cisgender people make decisions for transgender people when they don't know what it feels like to be misgendered? Hi everyone, my name is Namrata and I'm a human rights lawyer and activist. I've started this channel to talk about how social issues and policy decisions impact people of the world. I'm very thankful to be able to use my experience and insight to talk about global issues that lie at the cross-section of human rights, public policy, and international relations. I'm so happy that I'm officially launching this channel during Pride Month. This is a time for us to reflect on everything the LGBTQIA+ community has endured historically and rejoice in the triumphs of several individuals who have fought and who continue to fight every single day for full equality. It's also when we reaffirm our commitment to standing in solidarity with the LGBTQIA+ community in their ongoing struggle against discrimination. Now, it's important for us to understand that there are intrinsic differences in the challenges faced by the LGBTQIA+ community between developed and developing countries. Now, these differences are further amplified in the event of a global crisis like the ongoing pandemic. Now, as we all know, since the beginning of this year, India has been hit hard by a new wave of COVID. This crisis has posed a new set of challenges for everybody. But the impact has been worse for marginalized communities. Today, I'll be talking about how the COVID crisis in India has impacted the transgender community, what is being done about it, and what can be done further. Now, in India, there have always been long-standing discriminatory practices against trans people for decades, and clearly, healthcare is no exception. These discriminatory practices are a huge barrier that affect their access to not just healthcare, but also security, employment, and education. Now, earlier in 2019, in an effort to address some of these issues, the Parliament of India had enacted the Transgender Persons Protection of Rights Act. This legislation was intended to thwart the social stigma surrounding transgender people, prohibit discrimination against them, and improve their access to welfare measures, including health care. But while this is definitely a step in the right direction, the legislation doesn't seem to have gotten it quite right. Now, there are several issues with this legislation, ranging from the very definition of transgender persons to the ridiculously inadequate penalties for offences against transgender persons, which is, by the way, only 2 years. For the most heinous offences like sexual abuse and rape, the maximum punishment is only 2 years. Now, if I have to get into all the issues with this legislation, I'd have to make a day-long video. But there are two things that really baffle me about this legislation. First, there is a provision that requires a transgender person to apply for a certificate of identity. This means that for a transgender person to be recognized as such, they need government approval. So, you don't get to decide what gender you identify with. Government officials will do that for you. Think about it for a moment. Do cisgender people have to apply for a certificate of identity? Then why do transgender people have to do that? Perhaps all 1.4 billion of us should start sending out applications to get our genders checked and approved by the government. Second, under this legislation, transgender persons have to undergo surgery and show proof of this if they want to be legally recognized as a specific gender. So the gender you identify with will not be legally recognized unless and until you have had, and to quote the legislation, a surgery. Now, what about people who don't want to have a medical procedure, or who can't afford such a procedure, or who just can't get this done for a reason that is clearly none of the government's or anybody else's business for that matter? Well, according to this legislation, their gender identities are not valid and won't be recognized. Wow! This legislation is a perfect example of how the government is taking steps towards making things better for transgender persons, but they seem to be missing the point. The same pattern has been continuing through India's COVID crisis. Now, ever since COVID began, the trans community has been pushed to a corner in every which way. Starting with the financial implications, the second lockdown in India has left the trans community with greater financial problems than ever. Now, most of them have lost their livelihoods. Since many of them are denied mainstream livelihood opportunities, they have had to resort to begging or sex work. But the stringent lockdown in India has affected their ability to earn income even through begging or sex work. Now, as the trans community is pushed further into poverty, their mental health is also deteriorating. Take the case of Alia, a 26-year-old transgender woman from Ranchi. Alia died by suicide last month. She was disowned by her family and moved to Jharkhand around 11 years ago. Now, she supported herself by begging in trains. But after trains were suspended due to COVID, she starved for days. She then started begging at traffic signals. But once a full lockdown was enforced, she couldn't even do that. She exhausted all her savings and sold some jewelry to pay rent and food. And then, to make matters worse, her family, who'd previously disowned her, got back in touch with her for financial help since her brother had also lost his job. Alia's devastating story is only one among many. Now, in an endeavor to help transgender persons make ends meet, the central government organized a one-time subsistence allowance of 1,500 rupees for each transgender person. Now remember, this is a one-time allowance. One time. Now let's take a look at this amount. 1,500 rupees is roughly $20. This is certainly not enough money for a person to survive on if you include food, rent, and healthcare for the entire duration of the lockdown and the economic implications of its aftermath. Most of the transgender people who need this money don't have any health insurance, and that cost needs to be factored in as well. Now, the central government announced this initiative on 24th May 2021, and the members of the trans community were given a deadline of 31st May to apply. 1 week. That's all the time they had to apply for this benefit. This is a ridiculous deadline, especially since many members of the trans community weren't even aware that such a scheme was announced. And why were they not aware that such a scheme was announced? Because the government announced the scheme in a press release and relied on NGOs to spread this message using social media. all in 1 week. What an incredible idea! Many of the transgender people who live in poverty and who need the subsistence allowance aren't exactly floating around on Instagram and Twitter. They don't even have access to internet and other forms of communication. And during a lockdown, people working in NGOs can't exactly go knocking on their doors. How on earth would they have received information about this scheme? The government might have as well sent this information out using pigeons, and the chances of them receiving that information would have been much higher than them receiving this information from social media. At least they don't need cell phones or internet connection for pigeons to find them. Now, even if somehow they miraculously received the information to apply for this benefit, they are required to provide official documents, including Aadhaar card and bank account details. However, many of them don't have these official documents. They don't have this glorious certificate of identity I mentioned earlier that even recognizes them as a transgender person. And the 1 week deadline that the government imposed is certainly not enough time to organize these documents. Now, even for the small, tiny percentage of transgender persons who have these documents, this scheme is useless. Why? Because these individuals have been categorized as either male or female in these documents. And guess what? You can see where I'm going with this. They become ineligible for this benefit because they're not even recognized as transgender persons. So, while this sounds like a great initiative on paper, most transgender persons are actually ineligible to receive anything. That's how the system is built. The system is set up so that they receive nothing, but it appears to everyone like something substantial is being done. Now, moving on to the implications COVID has had on the transgender community's access to health care. Because of social distancing protocols, travel restrictions, curfews, and loss of livelihood, the trans community has been finding it more challenging than ever to get medical care during the pandemic. They've also faced disruptions in getting treated for illnesses other than COVID. Now let's take a look at what 33-year-old Anita Vashi told NDTV. She said that in Mumbai, many transgender persons haven't been able to get antiretroviral therapy for treatment of HIV because of the lockdown. Hospitals also refused to admit patients whose jaundice had worsened. They were told that their chance of survival was low, and admitting them would only take up hospital resources, which were already short due to a high number of COVID cases. So, the situation is that resources are limited. A choice has to be made with regard to who receives these limited resources. And if a choice has to be made between a transgender person and a cisgender person getting treatment, it's quite clear who will be picked. First of all, it's heartbreaking that people are put in a position where they have to decide who gets life-saving treatment and who doesn't. What's even more heartbreaking is that in making these decisions, the trans community is being told that there's no space for them, so they have to take one for the team. Too bad. Now, coming to those who have managed to somehow access health care. They experience transphobia and discrimination. when they go for PCR tests, people stare at them or hesitate to stand near them even after keeping a 1.5-meter distance. Anita reported to NDTV that many of them feel uncomfortable visiting hospitals because the hospital staff members make derogatory remarks and ask them to sit among men even when they're informed that they identify as women. Clearly, the government invalidating a transgender person's gender identity isn't enough. Hospitals have become an additional place where their gender identities are invalidated. So we've taken a look at what has been done so far. What's now important is understanding that what is being done clearly isn't enough for the transgender community, which is one of the most marginalized communities in India. So what can be done further? First, the government should introduce genuine schemes where a reasonable amount of money is given to every transgender person to cover their basic expenses during this crisis and its aftermath. The process shouldn't be as ridiculous as expecting them to receive information from social media, organizing documents, and sending out applications in the middle of a hard lockdown, all within 1 week. Second, we need action-oriented solutions that address the crux of these issues. The fact of the matter is, transgender people are not adequately represented, and this has got to change. We need more representation of transgender people in multiple industries and sectors. In the healthcare sector, the government, the parliament, the judiciary, the media, transgender persons have to be involved in formulating policies that address issues that concern them. Now, there have been a few instances where we are starting to see the light of day in terms of trans representation. For instance, recently, Dr. Aqsa Sheikh became India's first trans doctor to head a COVID vaccination center. But she herself pointed out that the fact that a trans person rarely receives such a role highlights the barriers and discrimination transgender people still face in India. Now, if you look at the Transgender Persons Protection of Rights Act, this legislation is faulty on so many levels. Now, this legislation was drafted and passed by mainly cisgender people. To what extent were transgender persons consulted or involved in drafting and passing this legislation? But how can cisgender people make decisions for transgender people when they don't know what it feels like to be misgendered? They don't know what it feels like to be questioned about what restroom they should be using, or denied access to health care and mainstream employment opportunities because of the gender they identify with. No wonder this legislation is so problematic. It's a perfect example of how privileged people make decisions for the underprivileged, and unsurprisingly, they don't get it fully right. They're so blinded by their privilege that they only see and hear what they choose to and resonate with. The lived experiences of the transgender community should be the foundation of policy decisions that impact them. And the only way this is possible is if they are adequately represented at every level and in every industry. So, I hope I've been able to at least scratch the surface of how the COVID crisis has impacted the trans community in India. There's a lot more I'd have loved to talk about, and I will bring this up again in another video. Now, I've spoken a lot about existing policies and how they're being implemented. But the point here isn't to blame anyone or point fingers. This isn't about governments. This is about the transgender community. A trans person is who they say they are. They belong to whichever gender they identify with. They shouldn't need a piece of paper or a medical procedure to validate their identities. They deserve to be treated with respect and dignity the way every human being does. They deserve to be heard. They deserve to be fully represented and have a say in decisions that impact them. This is the full spectrum of trans rights. So I hope you liked this video. Stay tuned for videos every Wednesday and Saturday on things that we should know and speak more about. Until next time.